Good morning, everyone. It's so wonderful to see you all. And thank you so much for joining us for our event, Caring for Caregivers, Supporting the Master Plan for Aging. My name is Catherine Kelly, and I am the Director of Government Affairs with Unlock.
Good morning, everyone. Welcome to our event. We're excited to have you. I am Uche Uwahemu, Director of Government Affairs for the Center for Elders Independence. In 2021, Unlock and CEI co-hosted an event introducing the newly released Master Plan for Aging to the North Bay. Many of you may have participated in that virtual event, where we came together to learn about the master plan's 5 bold goals and the important role that local communities have to play in making this statewide vision a reality. Now, 2 years later, we are here to rekindle the conversation and take a deeper dive on just one of the 5 bold goals for the Master Plan for Aging: caring for workers.
Thank you, Uche. And so before we share more about us and the amazing group who helped plan the event today, we'd like to learn more about all of you and to learn who is here this morning. So I'm going to launch a poll, and there are 3 questions that we would like to get answers on. So you should see a poll pop up. The first question is, did you attend our 2021 Master Plan for Aging event? Second question is, are you currently or have you ever been a caregiver? And this can be a direct caregiver, such as an IHSS worker, or a family caregiver where you're caring for a loved one or family member. And the third question is, what county or counties do you live or work in? We have intentionally partnered with many organizations today serving the counties listed here. And so we're curious, where are you visiting us from today? So I'll just leave this up for a minute. So it looks like we have a large percentage of folks who are joining us for the first time. So we are so excited to have you here and are so excited to be sharing the work of the Master Plan for Aging. We also have more than half of us have experience as a caregiver. And we hope that throughout this event, you not only learn about what's happening around these important issues impacting caregivers, both locally and throughout California, but you'll have an opportunity to share some of your experiences in some of the small group activities that we'll have later on. And lastly, we have a great representation from all of the county partners that we've been working with on this event. So very, very exciting to see you all this morning. Great, thank you so much. So for those of you who are joining us for the first time, I'd like to share a little bit about our 2 organizations. Unlock and CEI are 2 of the PACE providers in the Bay Area. So the PACE is a program of all-inclusive care for the elderly, and we provide all Medicare and Medi-Cal services for frail seniors as an alternative to a nursing home or a higher level of care that allows them to stay in their homes and communities for as long as possible. Unlock founded this model of care, and we operate PACE in San Francisco, Southern Alameda County, and Santa Clara counties. CEI operates PACE in Alameda and Contra Costa counties. And we were founded in response to a community need. Seniors wanted to age at home, but they needed services in order to maintain their independence. And so we certainly recognize the vital role that caregivers have in empowering our PACE participants and all older adults to live well in their homes and communities.
As a community-based nonprofit organization serving the Bay Area seniors for a combined 90+ years, we understand the importance of working with partners locally, statewide, and nationally to elevate the needs and voices of those in our community. Since 2009, Unlock and CEI have been co-leading the Bay Area Senior Health Policy Coalition, which is part of the SCAN Foundation's Community Advocacy Network. Through this network, we work with coalitions across the state to advance a coordinated and easily navigated system of high quality services for adults, for older adults that preserve dignity and independence. Today's event is supported by a grant from the SCAN Foundation, to advance local development and implementation of the master plan for aging. We thank them for their ongoing support. Now, let me talk about the planning committees. We also want to express our deep appreciation to our planning committee. This event has been many months in the making, and we could not have done it without them. Our partners from Marin, Napa, Solano, Sonoma, Alameda, and Contra Costa counties have volunteered their time for meetings, connected us with caregivers in their community to tell their stories, invited elected officials, helped with outreach, and shaped today's incredible agenda.
So you will have a chance to meet many of our planning committee members throughout our event today, because they are also stepping up to help facilitate sessions and introduce speakers. I know that this slide may be a little tiny to read, but we wanted to call out our amazing planning committee. So Kate Rauch with the West Contra Costa Senior Coalition, and Emily Hoshida with the East Contra Costa County Senior Coalition, Linda Jackson with the Marin Aging Action Initiative, Celine Regalia and BJ Bischoff with Providence Community Health Napa Valley, Jessica Rothar with the Alzheimer's Association, Susanna Meyer with Empowered Aging, Jenna Shankman with the Family Caregiver Alliance. And all of our partners represent multiple counties who are coming together for the event today. I also want to deeply express my appreciation to all of the Unlock and CEI staff who are helping to support things on the back end. Despite my technological challenges, they are helping make sure that everything else is moving smoothly. So thank you, all of them, for their support.
Thank you, Catherine. And now let me acknowledge our legislative staff. From Sonoma County Susan Goring's office, we have Aurelie Kubo Jones, Ned Miley, Alameda County Supervisor, Erin Armstrong, Monica Brown, Sonoma County Supervisor's office. We don't think we have anyone here at this point. Belia Ramos, Napa County Supervisor. We have Lee Dole Stevens. And Ms. Espinoza might be here. Not sure. Okay. Our objective today is to connect you to the master plan for aging's work around caregiving at the state and county levels, and empower you with practical tools to advocate, carry out this work forward in our communities. Building relationship with elected officials is key to advancing the master plan for aging. We want to thank the elected officials, legislative staff, and government leaders who are joining us today.
So shortly, we are going to launch into our program. I know we're a little bit behind schedule, but we will do our best to make up the time, but we have a lot packed in today. Shortly, we will hear some very powerful testimonials from caregivers in our community to help ground us in our discussions throughout the morning. We are honored to be joined by Susan DeMorris, the Director of the California Department of Aging, and her remarks will be followed by a panel discussion with county leaders from Marin, Napa, Solano, Sonoma, Contra Costa, and Alameda counties. Then you will have an opportunity to participate in one of 4 small group sessions. And this work will allow you to dive into some specific topics and talk about what can we be doing locally to create solutions on issues impacting caregivers. We will then hear a brief report out of those discussions and help energize us for an advocacy training, which will help cap off our event today. Again, as I mentioned, we have staff standing by, so if you have any IT issues throughout the event, please put a note in the chat. Sometimes also the easiest thing is to just leave the meeting and rejoin if you're having any connection issues. So now it is my pleasure to introduce Kate Rauch. Kate is the coordinator for the West Contra Costa Senior Coalition and contributor of Berkeley Side. She also served as a planning committee member and helped shape today's event. And Kate is going to introduce a video of powerful testimonials from caregivers in our community. Kate, I will hand it to you.
Thank you. So we're excited to be showing you about a 10-minute video that we've created of local caregivers sharing their experiences and hardships as family caregivers and as IHSS workers. These personal stories are from several Bay Area counties, and we think that they help get at the reasons why so many in elder care are working to improve conditions for those who are doing this vital, challenging, and rewarding work. We thank our featured caregivers for sharing their stories, and we also know that there are many others like them with lessons to teach us. Thank you.
Vivo en el condado de Solano, en Vacaville.
¿Y su esposo, él tiene problemas con su salud, sí?
Sí, la salud de él depende de mí. Él ya por él solo ya no se puede. Pues para cuidarlo, pues tener lo más importante, un teléfono de la casa. No tengo computadora, porque no tenemos computadora y no podemos hacer nada. Sin la computadora no se puede hacer nada. O no puedo hacer cosas importantes con la computadora, la computadora porque no la tengo. Para mí es muy difícil el teléfono porque en veces no nos llega, porque mi teléfono pues está chiquito, no es grande, no es bueno, es un corrientito el que tengo. Como hacer una cita, necesitaría la computadora, pero como no la tengo, pues tenemos que ir hasta allá y en veces no nos da la medicina, tenemos que esperar, o tenemos que ir con la doctora a decirle y luego regresar y andar en el bus. No, pues yo fui a tomar un curso de computing, pero pues como no tenemos, pues ya quedó ahí. Pero yo sí tengo mi certificado de computación, entonces nosotros pues, realmente no podemos. No, pues si ustedes tuvieran la facilidad de ayudarme a agarrar la computing, para mí sería más difícil porque pues nosotros yo no dependo de ninguna ayuda. O sea, pues nada más lo que le dan a mi esposo de su retiro. Pero pues con eso tenemos que pagar medicina, tenemos que pagar renta, luz, agua y todo.
My name is Dr. Shauna Van Cleve. I'm a pediatric dentist in Santa Rosa, California. Forgive my appearance, I am at work right now. I do advocacy in my spare time, which is minimal, because I am in my 40s, working off my student loans, trying to launch my adult sons into the world, and take care of my 51-year-old husband who has younger onset Alzheimer's. I am not in the same position that many of my peers find themselves in. I am not a retiree. I was not able to save for retirement when this disease hit. We were in the prime of our lives. So I am struggling to keep my head above water, financially, emotionally, organizationally, just to get through the day. So as it stands now, I have to reach out to each one of his specialists to coordinate care. I have yet to have any conversation with his hematologist, his neurologist, his neuropsychologist, his psychiatrist, and his primary care physician. We have never had a conversation that wraps up all of his care into one group of providers. This is not what is recommended by the Alzheimer's Association, by Medicare, by the Neurology, and the American Psychiatric Association. So as it stands now, my husband is receiving substandard care, and it is up to me, the caretaker, who is trying to survive and trying to do the best I can to take care of my husband and try to manage my staff and be a productive member of society. It is up to me to take on everything regarding his care. When we are at our most broken, when we are struggling the most, it is very hard for us to reach out.
Hola a todos, mi nombre es Humberto Elizarrarás, vivo en la ciudad de Novato, California. Tengo 9 años de experiencia trabajando con personas de la tercera edad, con personas discapacitadas. Tengo 2 clientes actualmente, uno de una señora de 66 años y un señor de 44 años. Trabajo casi 58 horas a la semana. Tengo que trabajar horas extras y fines de semana para poder sostener mis necesidades. Y una de las preocupaciones que tengo con uno de mis clientes es, pues es una persona discapacitada que está en silla de ruedas, tiene más de 300 libras y pues sí es un miedo que tengo de lastimarme físicamente un día con él. Uno de los retos que tengo con ellos es con la tecnología, que muchos no la entienden, no la comprenden bien. ¿Qué es lo que hago cuando conozco una persona nueva, cuando voy a visitar mi primer día de trabajo con uno de ellos? Es observo la casa, las condiciones donde viven, para ver si encuentro como un peligro, algo donde están, algo roto, una silla rota, una cama rota, o algo donde yo crea que se tiene que arreglar para poder comunicarme con un trabajador social. Otra cosa es cómo tener un oficial electo que pueda entender, comprender las necesidades de uno, alguien que pueda estar en los zapatos de uno, ya que pues el salario no es alto, los beneficios no son los mejores. Así es que sería algo conveniente tener alguien que nos entienda, que nos comprenda nuestras necesidades. De ahí para allá me gusta trabajar con personas de la tercera edad, me gusta trabajar con personas discapacitadas, me gusta trabajar con personas que necesitan de uno, y eso es lo que pues me satisface. Gracias.
My name is Terry Carlisle, born and raised in Vallejo, California, where I currently reside. And I am one of the caregivers for my wonderful father, Fletcher Lee Carlisle Sr. And I am one of his caregivers because he's my daddy. Like, what else can I do? He's not bedridden and he's not paralyzed, but he's very weak on his left side. And unfortunately, through his medical, they didn't allow him to go to the, what is it called? The rehab center that they are known for. So we were able to get, I believe, 6 sessions with a physical therapist, 6 sessions with the occupational therapist, 6 sessions with the nurse. And then that was pretty much it. Then they turned off the water. And so now here we are trying to make sure that he has the best care possible. We have a personal trainer that comes in to see him 3 to 4 times a week. That's like anywhere from $180 to $240 a week. And then we have also had like nursing assistants come in to help my mom with the bathing of my dad. And unfortunately, it's hard to find good people who are available. And so we've reached out to different in-home care places. When they came to give us the estimate on how much it would cost for them to provide somebody, it was upwards of $8,000 a month. The good thing about it is that through the pandemic, I've been able to take on additional work. So I do work 3 jobs to help take care of the cost of providing for my father. And so not only do we have a personal trainer come out, because we want to make sure that he doesn't curl up, we also have a barber comes once or twice a month to shave him and make sure he looks pretty. And so, we have a meal prep service to help with the cooking. We're just trying to help alleviate all that we can from my mom, because it's a lot on her. And it's costly, but I wouldn't change it for the world. We do what we have to. And so I know that in-home support workers are not paid very well. I think the last time I checked, they were probably getting like $12 or $14 an hour. And so that's why when we started looking for folks, I was like, well, the least we could do is pay people $25 an hour. And so I was thinking, okay, well, we should be able to find somebody for $25 an hour. And so we did. We found some people, but unfortunately, like all the job markets, it's a struggle to find people that you can depend on to come each day at a particular time. And so the folks that we found, either they were having car troubles or they were having transportation issues. And so it has just always been a struggle to find someone who can make it here. And what I have noticed is that you're right, most of the in-home support workers, they are low-income women of color, whether that's Black, whether that's Filipino, whether that's Asian. Yes, that is the demographic. We want caregivers to want to do what it is that they're doing. We don't want anybody to have any animosity. We don't want anybody to be resentful. And so I know for me, I just look at the fact that it's my daddy and he's done everything for me. And so some people might look at it as a burden or inconvenience. And I just turn my mindset like, well, hell, I was a burden and inconvenient for the first 18 years of my life. So now the tables are turned. And so it's all good. And I'm here to give him the best life with the most dignity that I can provide.
Thank you, Margarita, Shayna, Umberto, and Terry for your vulnerability and your advocacy for sharing your powerful stories with us. Your testimonials remind us of the challenges that caregivers face every day and that we need to leverage the Master Plan for Aging to support you. It is now my pleasure to introduce Jessica Rothar, who is the Senior Manager of Public Policy and Advocacy for the Alzheimer's Association. Jessica also served as a planning committee member for this event and the one that we hosted in 2021. And Jessica will introduce our keynote speaker.
Thank you very much, Catherine. What if you could invest $200 million to support these caregivers and the people they're caring for? That's the kind of question that Susan DeMorris, the director of California Department of Aging, has been thinking about and acting on since Governor Newsom appointed her to lead the Department of Aging 18 months ago. I had the enormous pleasure of working with Susan before she was appointed to that position. And I can tell you that we can thank Susan for the fact that we even have a master plan for aging. She is a brilliant strategist who understands how to shape and win policies to improve people's lives. Susan's leadership at the department has been a game changer. It would have been so easy for the master plan to be put on the shelf to gather dust. Instead, we're seeing exciting new state initiatives and funding to meet the needs of caregivers, older Californians, and people with disabilities. In just the last 18 months, Susan has led the investment of more than $100 million to create more residential care options, $89 million to support caregivers, creation of the nation's first dementia care aware training program, and more than $17 million to close the digital divide. But what I love about Susan is that she is a heart-centered, compassionate leader. She has been a caregiver for her own mother, and she represented caregivers in the state capitol for many years. She deeply understands caregiving from a personal as well as a policy perspective. So please join me in welcoming an extraordinary leader who is making a difference for aging Californians and the caregivers who support them, Susan DeMoras.
Oh, thank you, Jessica. Okay, I'm that video in your introduction, I think I'm very touched, and I'm honored to be here joining you, and I'm so impressed with what these 6 counties have been doing together for so many years, long before there was a master plan for aging. And I think today you're exemplifying 2 things that we're really striving to do, which is within the California Health and Human Services Aging and across government, is to collaborate. So I just admire so much that you're working with local government across 6 counties, CBOs, consumers. This is a true collaboration. And we're also trying to focus, because this is a big job. So I really appreciate that today you have a focus on caregivers for our time together. I want to thank Unlock and CEI for co-chairing this work, and especially the 13 planning committee members, including you, Jessica. And I love the 4 questions that you're going to be diving into later. They are the same questions. This is how you know we're on the same track, because they are the same questions that we are grappling with at the Department of Aging. I will say that it's great here in Northern California today that we can focus on something we hold in common. We may have different teams we want to win tonight when the Warriors face the Sacramento Kings, but we're all unified on family caregiving, and I'm glad we can talk about that today. So do you have a good view of the one slide now? Is that all that you see on the screen before I proceed?
Yeah, that looks great.
Okay, great. All right. And I'm going to ask to have a copy of that video to share with our executive team at CDA when we meet next week. So I don't know if that's available to share, because it really just touches on all the things that we're working on that are part of the master plan for aging, which, as you know, is a 10-year blueprint for our state. We're in year 3 now. And I know that we're a little bit behind time, so I'll move quickly through some of these slides. This is a group I think is familiar with all 5 bold goals of the master plan for aging. Today, in our time together, we're focused on goal 4, caregiving that works. We just re-upped. I heard, you're doing the same here after not being together since 2021. In January of this year, we released our annual report to the state legislature, and we recapped all of our successes, achievements, and unfinished business from the past 2 years. In the middle of your screen, you see that we also launched 95 new initiatives in January, and this is our North Star for the next 2 years. Our initiatives coincide with the legislative process. So we've identified 95 initiatives across all 5 bold goal areas that we'll be focused on over the next 2 years. And on the far right of your screen, you'll see our new initiative tracker. This is something we're very proud of, because it allows anyone, anywhere, at any time to go in and search for an initiative by name or number, or you can enter a keyword such as caregiver, and up will pop all of the activities associated with that, where we are, who's working on it, and give you the detail you need. We're really proud that we can be transparent in that way and to pull in the public in a new way. So the master plan for aging is a whole of government approach. And what that means is it includes, we often forget, it includes our federal partners. And certainly with caregiving, with older adults, with people with disabilities, there's a huge part that the federal government plays. It also includes the governor's cabinet work group. So that's, of course, our Health and Human Services Agency Secretary, Dr. Mark Galley, but it includes our housing agency, our labor agency, emergency services, natural resources, and climate change. All of government is involved in this effort. Most of the work today is happening in the California Health and Human Services Agency. So that includes Medi-Cal, it includes in-home supportive services, it includes adult protective services, and of course, the department, I represent the Department of Aging. And then I'm so thrilled that today we have local government joining us, and that has always been the vision, that this work would be owned and embraced and led at the local level. So thank you to all of the local leaders who are joining today. So I wanted to just, on the caregiving space, I wanted to note two, in our whole of government approach, two very exciting, unprecedented things have happened at the federal level. At the end of last year, President Biden released the National Strategy to Support Family Caregivers. There has never in the history of our country been a national strategy to support family caregivers. We're very excited about that. And right now at the Department of Aging, we're mapping all of California's plans and initiatives and strategies against that to see where we fall short. And we know that we do. So we're looking at that right now. And then just last week, the president issued an executive order to help direct care workers and family caregivers. And we're still analyzing that. But between these two documents, I just want to say, this is an encouraging time, to have the word caregiver actually coming out of the White House and at the national level, and something that states and local governments can pick up. So we are committed to building off of this momentum and taking these two federal initiatives as far as we can. I mentioned that we re-upped our initiatives for the next 2 years, and I wanted to share with you, and I'll put in the chat after I'm done talking, how you can access this information. But there are 4 of the 95 initiatives are focused squarely on unpaid family caregivers. And then there are about another half dozen or so that are specific to the direct care workforce. So I'll make sure you have a way to access those 4 initiatives. The biggest effort at our department, California Grows, is a combined effort. We received $150 million from the legislature approved by the governor. And we are so proud that we are able to direct those resources to both direct care workers. This would be home care workers, home health workers, staff in adult daycare settings, staff in PACE centers, anyone other than an IHSS worker, because there's a separate initiative just for IHSS. But also we're able to support family caregivers. So we were so pleased to release 76 grants to 85 organizations up and down the state for a total of $87.2 million. Those contracts are being signed and issued right now as we speak. And many of those organizations are on this call. So we're just thrilled beyond belief that community-based organizations that are so close to caregivers, so close to the workforce, furthering our equity goals, working directly with people of color, working directly with the LGBTQ community, are the recipients of these grants. For those who don't know, we have 2 mechanisms in our state to deliver family caregiver supports. The first is through our 33 area agencies on aging, and several of them are represented here today on this call in the 6 counties that are included in the forum. We also have the state's 11 caregiver resource centers also represented today on this call. And we're pleased that the Department of Aging now oversees both the caregiver resource centers and the area agencies on aging. And while they aren't, while one is 33 and one is 11, both of them cover the entire state, and they're responsible for all 58 counties. Our focus in the next 2 years as a department. 2 things I wanted to fill you in on in our continued effort to really put people at the center of our work. We're going to be focusing on older adult behavioral health, and that absolutely overlaps with family caregiving and the direct care workforce. We just concluded yesterday in San Francisco. Thank you, Onlock, for hosting us there. The fourth of 4 listening sessions we held around the state: Ukiah, Fresno, San Bernardino, and San Francisco. We've made great strides in our children and youth behavioral health system, and we want to do the same for older adults. The next item I wanted to flag for you, because you may be involved and will ask for your partnership, is we are conducting the first ever statewide older adult survey in California. It's just incredible that we have the resources to do this, because we will be able to survey older adults to hear firsthand from them about how they're doing, what they need. And we're able to do this in 7 languages, and we're doing it in all 58 counties. And we'll have data that we can compare from county to county, from area agency on aging to area agency on aging, and really get the first composite picture we've ever had of how things are going for older Californians in our state. And then last, I wanted to mention, and this absolutely came through in the video, I heard snippets of this from the 4 caregivers who you recorded. It's very difficult to navigate the long-term services and support system. We recognize that. We are endeavoring to build a no wrong door system. It will take us many years to do that. We want to break down silos. We want to make things as simple, streamlined, and easy as possible for the consumer, for the care recipient, for the older adult, and for the caregiver. And a big piece of that is expanding our aging and disability resource connections. And I want to thank all of those on the call today that are part of that expansion effort as a designated or emerging ADRC. And then last, what you're doing today, I wish we could just, cut and paste this all over the state, because stakeholder engagement was central to establishing the master plan for aging. And it is more critical going forward than it was even then establishing it. When we say it's a plan we don't want to sit on the shelf, that means at the local level too. If any of us at the federal, state, or local level become complacent and think the master plan for aging is doing the work for us, we're mistaken. We have to work as hard or harder in the years ahead, and we have to do that across sectors. We have to do that by uniting the aging and disability communities wherever we can. We need to do that through our advisory committees, and many of you serve on those advisory committees, by uplifting the local playbook that you're working on. And thank you to the SCAN Foundation, who's supporting today's work, but also supports the local playbook work. And then to continue working with our foundation partners. We're incredibly grateful that the master plan is supported by 7 foundations. And we know there are local foundations also supporting your work locally. And that's critically important as we continue this public-private partnership. And that's what I've got in terms of slides. Happy to take questions if there's time, or to just step back and continue listening. Thank you for inviting me today.
Thank you so much, Susan. So I want to open it up for folks. This is a rare opportunity to have the State Director of Aging with us. So I want to open it up for questions. We have we welcome people to put questions in the chat. Let's give people a second. I want to start with a question, Susan. So can you say a little bit more? I love the system you and your team have created of having a dashboard. And now you're talking about mapping from the President's Caregiver Initiative to our state initiatives. Can you talk about where you see, when you mentioned that we know California is falling short, if you could wave a magic wand, when you look at the president's plan and where we're falling short in California, where do you think 2 areas of focus would be?
So I think if you look, nationwide, we're probably doing better than most, or even better than all, and I can point to our caregiver resource centers as an example. No other state has a statewide network funded by the state general fund for more than 30 years, dedicated solely and exclusively to family caregivers. But in our whole of government approach, I do think there are things, 2 things I would point to. There's probably more that we can do with paid family leave. And I appreciated hearing from one of the individuals on the video who's full-time in the workforce. I cannot imagine how difficult that is for her, raising, teen children, caring for her husband, and trying to run a dental practice. So we really want to, turn over the paid family leave and make sure we're, squeezing the maximum out of that. That's not necessarily a Health and Human Services initiative, but it's a linchpin. And then a big effort that we're working on that will absolutely take multiple years is developing a long-term services and support benefit of some fashion. So we know that a lot of caregivers are caregivers because they can't afford to hire help or to attend an adult daycare program or adult day healthcare, or even when appropriate, place in assisted living when needed. So really looking at how do we support the individual and in turn support the caregiver by helping what is referred to as the forgotten middle or the missing middle, people who aren't yet qualified for Medicaid, but are teetering on the brink of it. And we've done so much in California. We eliminated the asset test, which expands Medicaid coverage to far more people than ever before in our state who didn't qualify previously. We also expanded coverage to all undocumented individuals 50 and above. So that's a gateway to some of the home and community-based services that we provide, like IHSS and CBAS, but in no way covers everyone or everything.
Wonderful. Thank you so much. So we do have a bunch of questions now in the chat. We have to wrap up, but I want to pick one that's come up a couple times. Will there be ongoing funding for these programs? They're such great initiatives.
So right now, you'll see with our 95 new initiatives, we adopt 3 criteria. So everything is tagged as either something we're delivering, analyzing, or communicating. And those things that we're delivering, quite a few of them actually will go away because it's one-time limited funding. But in the analyze piece, that's where we're really, I ask for your patience because there are a lot of things where we are collecting the data. We're doing a statewide gap analysis. These aren't direct services, and that's frustrating, but we're really trying to build the data and the business case for a lot of these programs and services so that when the funding goes away, we can make the case to the administration and the legislature. And that also means some of them will go away because there's not a business case or the data doesn't support their continuation. And that's healthy too, after our department will celebrate 50 years next year. So we won't be doing all of the same things we've been doing for 50 years, but we will do new things that we've never done before. So just stay with us and keep communicating with us and be part of it. And we're committed that, there won't be surprises and it will all be done through the stakeholder process if there are any big changes. But that's what I would say.
Thank you so much, Susan. We have to let you go. There's some questions we didn't get to. Can we send those to you and get answers for those people?
Sure, absolutely.
Thank you. Thank you so much. It was lovely to have you with us.
It's great to be here. Thank you all. Have a great day.
Bye-bye.
Thank you so much, Susan. Thank you so much, Jessica, for both of your respective leaderships. So we are going to now transition to our legislative panel discussion with county leaders. So we are skipping our break because we want to stay on schedule. You know, I think we all know we need to take a break. You know, we all are able to do that. So, so we are going to pull up all of our panelists. So just give us a moment, and then I'm going to hand it to Susanna Meyer with Empowered Aging, who is going to facilitate the discussion with our fantastic county leaders.
We are going to start with a personal connection. We're interested to hear what challenges have you experienced personally or seen friends or family caregivers experience in your community. And can we start with Supervisor Sackett, please?
Good morning, all. Thank you for having me. Marin County Supervisor, and my mother was my role model and a former appellate court judge who then went into dementia in her late 70s. And so I was a caregiver for her oftentimes from afar. And so sort of how do I support the caregiver who's next door, and navigating all of the forms and getting folks to show up, you know, navigating. My mom was not a willing and lovely patient, frankly, so she didn't treat caregivers very well, which was hard to watch, but probably not uncommon. And so, you know, she would fire people or accuse them of things. And so just kind of going through that and then navigating through, you know, a nursing home and then memory care and hoping she didn't get kicked out. As I was running for political office, really hoping she didn't get kicked out that week. So just while raising 2 kids at home. So, I know that so many in the stories that we heard earlier are much more compelling, but really feeling that sandwich generation of caring for somebody while also trying to keep life going forward. So thanks.
Thank you, Supervisor. I think a lot of us are in a similar sandwich generation position as you. Tracy Murray, Director of Aging and Adult Services. Can you pipe in on that?
I can, and thank you all for allowing me to be here today. So the quick story of my mother, who is alive and is 83, is she was born into poverty, had 1 child. I am her only child that she had when she was unwed and was fleeing an abusive partner. She picked herself up, worked through a variety of jobs, ended up having her own business, obtained her pilot's license, was married 3 times, is an avid gardener, and ran a well-kept and orderly life and house. In her 70s, she developed dementia. Her symptoms increased, and by her late 70s, her husband was no longer able to engage in her support. And even though I'm the Director of Aging and I oversee APS and all those problems, we had the experience of learning that her husband also took some of her financial assets. He went into their joint accounts and pulled money into his individual account. I became my mother's caregiver when she and her dog moved in with my husband and I. And I'm really grateful that my husband and I have resources. We're both employed. My mother, through her hard work, has some financial resources. So ultimately, we were able to get caregiving help. What I can say, though, is that as a caregiver, I experienced, even with all these resources, anxiety, guilt, loss, fear, and that it's a really rough road. And I sympathize and can relate to all of the caregivers who are in similar circumstances.
And I think, Tracy, you bring up a very good point about the fact it doesn't matter your position in the community, your position in the aging industry. We are all impacted by these concerns and issues. Have any other supervisors, do you have personal experience or relatable experience to this question?
I will go ahead. I'm Delia Ramos at the County of Napa. And Tracy, hearing your story of being a single child and having to be that support, my experience is the exact opposite. I come from a large family, and as my Nana was experiencing complications at an older age of diabetes, complicated with dementia, we had the exact opposite. We had a lot of family. We were able to take shifts. I was Monday, Wednesday, Friday breakfast, and we'd have people that would stay at night, and it made me feel so incredibly grateful for the first time to be from such a large family. Growing up, maybe not so much, but it also gave me the awareness of how difficult this must be for families who do not have that larger safety net to be able to provide not just the personal care, but to be able to share the emotional heaviness. That I don't want to say burden, because I feel like it's just a cycle of life, but that heaviness, there were many of us to share in that. So for me, really having that awareness that not everyone is as lucky to be from a large family that could help carry this load, that has certainly been a personal experience that I carry.
Supervisor, I think your use of the word burden, it's an impactful word. It's kind of a negative word, but it is also the reality. Supervisor Miley.
Yes, thank you. I want to thank CEI for giving me the opportunity to serve on this panel and speak today. I'll provide a personal observation, but I'll also provide observation from my position as president of the United Seniors of Oakland and Alameda County, and also working with SEIU Local 2015. Personally, both of my parents have passed away. They live out of state, and we had to provide a caregiver for my mom. And that was a little challenging, but we were able to manage that. But the worry and the stress around that was certainly of concern, and trying to see how we can address this and have those cohesive networks, not just in our state, but nationally, I think would be very helpful. Now, from my position with United Seniors, we know, in working with SEIU Local 2015, that there's a shortage of IHSS providers to provide the necessary care for the recipients. We also know that the providers are not paid a very good wage. They need a living wage, and living in the Bay Area, the cost of housing is quite a challenge. So ensuring that they're housed and that they have a living wage is also an important challenge. And then the other thing we've heard is just establishing a career path for these providers. It's also a challenge. So those are some things I would outline.
Thank you. Thank you. Supervisor Brown or Goran, do either of you have a personal experience to relate?
I do. And first of all, it's such a pleasure to participate in the panel with other supervisors. We don't have enough opportunities to compare notes and talk about our similar experience serving as supervisors. So thank you. It's grateful. I'm grateful to be on here. We are so fortunate in that we were able to celebrate the 97th birthday of my husband's mother about a week ago. And I had no doubt that she would make it to 97 to 100 and beyond. However, she contracted the flu around Thanksgiving. And to watch her transition from a vivacious, opinionated, feisty woman playing duplicate bridge with my husband and friends and neighbors in October, and then contracting the flu. And now she is on oxygen 24/7. With a series of caregivers. And I had to chuckle, Mary, because we had a similar experience where she would fire caregiver after caregiver after caregiver and greet them at the door and say, I fired you twice. What don't you understand about that? So we are fortunate in that we did find a caregiver who is loving and they get along beautifully. I think it probably took some acknowledgement on her part that this was her life. And so hospice has now been called in to provide care and comfort, but I don't expect this feisty woman to give up quite that easily. So I have empathy now from personal experience for every family, whether they have an IHSS worker or private caregiver, to understand the limitations, constraints, and challenges of working with an aging parent and the caregiving institution.
Thank you for that. Supervisor Brown?
For me, I personally haven't. My parents are gone. But the one thing that I've noticed, and it's interesting with the Napa County supervisor, because I see that down the road as a problem when a lot of us are not having a lot of kids. But for me, just watching, because I'm a retired teacher, my retired teacher friends, is that when many of them get dementia or cannot take care of themselves and trying to find just respite care, they don't want somebody coming into their home. And then the caregiver does not get any rest at all. And that's a big concern that I'm not sure how we can work with. But that's the only thing that I just wanted to share, because I know we have all these other questions to get to, but there is a lot. But to the supervisor from Alameda County, I get in-home support services 2015 years ago, I went out and got signatures to get that happening. The problem is the funding, and I'm sure we'll get to that when we get to that question. So anyway.
Thank you, Supervisor Brown. And it's interesting, I think, for the people watching to see both the personal experiences and the work that you're each individually doing to support these issues. And I thank you, Supervisor Miley, for some of the work that you're doing in that area specifically. We're going to take this now to the county level and ask what measures can be taken at the county level to support training and respite needs of unpaid family caregivers. And is there anyone who would like to start with that? Supervisor Brown?
Yeah. So what I think that the county can do, and we can do more of, is to provide weekly phone calls, but to the caregiver. The caregiver needs somebody to talk to. I'm not thinking in-home support services, they come and go. I'm talking about somebody who might be a family member that's coming in and is staying there, or a partner. Because you need to be able to have a shoulder to cry on. You need to be able to say, I've had it. And some of us who are parents, sometimes you get that way with some of the kids. And because when you get older, that happens. And I think that what we need to do is to see what we can do to help give caregivers respite. I know that's not easy. I know that we have money in Solano County for like maybe 2 weekends a year, but not for everybody. And I think those are the things that we have to work on. And so those would be the things that just so that somebody can call them. We do that already, but during the pandemic, we called our seniors just to check on them. I think we also need to do that with the caregivers, and we need to add that. So that's my thought.
So at a county level, say, for example, through the area agencies on aging programs, are we thinking there's some programs that we could implement?
Well, we do have that with PPP. I'm sorry, I apologize for not knowing all the acronyms, but we do have that where we do pay a nonprofit to call our seniors to check on them. I think we also need to add to the caregivers that we just check so that they can have a half hour just to vent. There's nothing wrong with that. It helps. And we're not saying anybody's a burden. That's not even where I'm going with. I saw that in from Debbie Toth and stuff. It has nothing to do with that. It has to do with, you need to be able to vent, because if you don't, then that's when we get into abuse and some other things like that, just because there's animosity of why me. And I think we need to come to a realization that in Solano County, we have over 100,000 seniors. We are not taking care of everybody. We do not have the funds for that. And I think we need to have what I call the coming to Jesus moment and figure out what are we going to do as we age, because there's more of us baby boomers, and what's going to happen. My kids have decided. Growing. So anyway, I'll go because other people need to talk.
And I think I saw Supervisor Gorin and Supervisor Miley looking like they might want to speak.
And I think we probably all want to speak because this is so important. I want to provide a quote from Rosalind Carter. There are 4 types of people. Those are people who are currently caregivers, those who will be caregivers, those who know a caregiver, and those who need a caregiver. And I would think all of us on this panel are in certainly the latter category. It would be interesting to find out from all of the supervisors what proportion of the counties are considered aging seniors. And in Sonoma County, we have about 139,000 people age 60 and older, about 28% of our population. And I want to thank Solano County because they are the home for many of the caregivers traveling into Sonoma County and Marin County because they can't afford to live in either of our counties. So we know that our caregivers are really struggling. They're underpaid. There's a gap of caregivers. And as I just said, they're traveling far distances to get to their clients' homes. I don't have an answer for training of caregivers. I think we sort of evolve into it. They're very caring people, and a lot of the care agencies really help to train the folks. But we need to acknowledge the sheer number of folks in the county who are waiting for caregivers, either through IHSS or on the waiting list for caregiving agencies. I really think that is the chore, and that is the challenge for all of us in developing the master plan on aging in each of our counties, to identify the gaps and identify the resources for training of our caregivers. And I want to echo the concept, the previous thought of we need to pay them so much more. A living wage of $25, they are not getting that from the caregiving service providers.
And thank you for everyone bringing this to the specifically for the unpaid family caregivers. Partnerships with nonprofits, perhaps, or again, any kind of programmatic thoughts on that. And Supervisor Miley, I believe you were ready to speak as well.
Yes. Well, in Alameda County, we have over 200,000, actually, so 300,000 older adults. And in terms of the IHS providers, be 30,000 IHS providers and close to 30,000 IHS recipients. I'm just kind of rounding things up. But we have two things I would like to state. Through our Council for Age-Friendly Communities, we spearheaded a training initiative called Embracing Aging to equip workers to meet the needs of older adults across a varied service delivery settings. Also, through our area agency on aging, I really want to thank our Department of Aging and Adult Services. They're providing contracts with diverse community-based organizations throughout the county to provide family caregiver support services, which includes counseling and support groups, respite, information and referral, as well as education and training. So we've got two programs that I would highlight at this point in time.
Thank you. Alameda is clearly doing a lot in that area too. I wanted to point out there's a lot of really great feedback in the chat, and I'm hoping that at some point the supervisors can all take a quick look through to see some of these follow-up questions and other suggestions and feedback to what you're sharing today, because there's a lot of really great information that you're all sharing about what your counties are doing. Supervisor Ramos or Sackett, either of you, would you like to speak?
I have a couple of comments, if I may. In addition to, from the county level, advocating for additional affordable and workforce housing, and ensuring that we're maximizing all opportunities on pay for IHSS workers and bolstering that to the extent that we can. I think first and foremost, what we as a county workforce and a county entity can do is make sure that everyone is being treated with dignity, and that, that we're all trained and aware of. I think any of us who have been a caregiver and navigated the world kind of see oftentimes how older adults can be overlooked or ignored. And so making sure that county staff have that training if they don't have that personal experience. And then I think the biggest issue that the counties can do is to help in navigation. So having a one-stop shop and phone number so that when caregivers are trying to find, services, when you call for transportation, also asking, do you need help with food, medical appointments, coordination, et cetera. And cutting out the sort of paper circles and phone trees as much as absolutely possible, just knowing that caregivers are struggling. And what I'm hearing from IHSS staff is that the federal government is triggering a new electronic reporting and check-in requirement, and what a burden a fear that there's going to be a real burden for not only the recipients, but the caregivers in having that, the right technology in order to do some of those things. So again, just always thinking that when we're inventing new programs or new services, are they making people's lives easier or harder? And we need to focus on simplicity.
Thank you, Supervisor Sackett. And I think the idea of educating staff is a really good point, to make sure that when they are interacting with people who are going through challenges like this, that they can be compassionate, they can be very, they can hear them and listen to them and understand what they're going through. Thank you for that. And again, of course, navigation, critical component to any of these support services. Supervisor Ramos?
Thank you. I absolutely echo Supervisor Sackett in saying those caregivers that can be transferred into paid givers is incredibly important, not just from an economics perspective, but really for compensating, not fully, we all know that it is not fully enough, but for compensating the work that is happening, because it shouldn't just be borne by a few. One of the things that, in addition to the investments into AAA, of which NAPA is in a partnership with Solano County on the AAA to be able to provide those respite services, back to the navigation. One of the things that we've done in Napa County is we have used our master settlement dollars, our tobacco master settlement dollars, to fund community organizations. And it's a commitment that the county made years ago. And one of the things that we do is we actually, through those tobacco dollars, we are actually funding a navigation system for information and access to information through Collaborative Care, which is part of Providence. And so that is something that we fund, understanding that this organization is already has those established relationships, and for us to be able to support that, I think, is incredibly important. As we look to, and your question of what else can we be doing, understand in Napa County, 20% of our population is over 65. While we're the smaller of the counties here, that is a very large percentage for us. And we also have a state veterans home. So I think it's really important for, as we look at each of these counties, how we are transforming the work that we do through Health and Human Services to adapt to this growing silver tsunami coming our way. And one of the things is really to start using public health. Public health is that little department that no one knew existed, but I mean, they can do miraculous things, and we know that now. But to utilize public health in a way of that education of caregivers, right? Because if they're not going to be in the networks of supportive caregiving roles, we still have the opportunity from the county perspective through public health to be able to support those caregivers, but really focusing in on that navigation so that people know where to go. And I would just encourage everyone, look at our master settlement process, all the counties, look at our master settlement process and how we utilize those funds. They do not roll into the general fund. We put them in a trust and then we reinvest them back into the community for our growing needs. And this is one of our growing needs.
I love the out of the box thinking on this. I think it's definitely a significant need and a creative way of looking at it. So we do have a lot of questions to get through, and so I'm going to keep going and ask if there is a question you don't feel that you need to respond to, please don't feel obligated. We have so much to talk about, and I want to make sure everyone gets the chance to speak on those things they feel most passionate about. So our next question is about one of our most significant learning experiences in the aging and disabled community in many, many, many years, and that is COVID. So during the pandemic, older adults and adults with disabilities who depended on care from caregivers were, of course, disproportionately impacted. Staff who worked in long-term care facilities worked multiple jobs as a result, spread infection to our most vulnerable community members. And unpaid family caregivers were often afraid to leave their homes for fear of bringing the infection back home. What were the impacts of COVID on your county, and what lessons did you learn? Supervisor Miley, please.
Thank you. Yes, this is a very important question. You know, the pandemic was really destabilizing for a lot of our seniors. I'd say for practically all of them. And we learned that as a result of working with our CBOs, conducting surveys, and we found out definitely that the pandemic, you know, produced higher rates of depression, decreased mobility, did so many things in terms of affecting the quality of life of older adults. And before the pandemic, we knew that almost half of the older adults in our county, they were living below the Elder Economic Security Index before the pandemic. And then as a result of the pandemic, that produced even more insecurity, both food insecurity, housing insecurity, you know, loss. It had an effect on their, you know, their morale, depression, things of that nature. And then the other thing we found is that, and it's kind of been mentioned, many of the seniors and the folks who required these services were receiving them from the sandwich generation. And that put more pressure on those individuals in the sandwich generation. They were caring for both younger, you know, their children and others, and then they were caring for older adults or just, you know, folks who were disabled. So that put more pressure on them. So the lessons we learned was that technology played a very important piece of this. And it's extremely important that seniors be connected to technology and have access to technology, broadband, understand it, and be comfortable using it. And we also found that technology in this new world that we've come to understand is an important tool that allows us to train our staff and train people as well. So those, I think, were the two pieces that we learned, because prior to the pandemic, use of technology was something that we weren't really embracing. That's what I would say.
Thank you for that. I think that is a big issue for the connection portion of that. Supervisor Gorin.
Well, we learned such powerful lessons about the needs of seniors, especially about social isolation. It was so hard for families. It still is so hard for families to care for aging parents when they are still fearful about going out into the grocery store. They still wear masks, fortunately, but many of our families are still shopping for our family members because they fear going out. That has a real ripple effect. And I think the social isolation has been understated and of course leads to poor health outcomes. Some of the coping mechanisms that neighbors discovered is little drop-ins on backyard patios, an opportunity to have a little conversation with the neighbors. I think that's very important. But also we have a number of the Council on Aging and a number of nonprofits really focused on digital literacy for seniors, getting them comfortable about accessing information, finding out how to get the information that they need for not only caregiving, but also the social services that they might qualify for. And I think we should really recognize the Council on Aging and the Meals on Wheels and so many other organizations have literally been lifesavers, delivering meals to our seniors who do not want to go out and desperately need the nutrition and the groceries on a weekly basis. So this is such a success story of community coming together and community organizations evolving to fill the need.
And I think that's a very good point, because so many nonprofits that I'm aware of had to pivot their model to be able to supply the services and resources they needed to do. Supervisor Gorin, before I turn this over to someone else, I understand you have to leave at 10:30.
No, it's fine. I've arranged my schedule, so I'm here.
Thank you.
Great.
Thank you very much. Who else would like to speak on this? I think Supervisor Ramos.
Thank you. I feel like Supervisor Miley jumped us forward when we talked about technology, but I think it's actually very important in the space of talking about isolation and everything we learned about the negative impacts of isolation. So one of the things that the Napa Solano AAA is going to be doing, it's going to be funding iPads for older adults that have permanent disabilities and meet certain criteria. So in Napa, we're going to get about 400 devices, but we've also applied for a grant, an access to technology grant, to be able to acquire more devices in Napa County. And so for people beyond those strict eligibility requirements under the AAA grant. But one of the things we did, exciting, we are partnering with our library, and we are going to have information sessions to be able to get people signed up, to get our seniors signed up for discounted internet and for tablet and laptop access. And it's completely voluntary, but one of the things we want to make sure is that people have the access to internet and devices, are able to have questions answered, and to be able to transition into the new way in which a lot of information is being disseminated, much to my dislike at times. Another thing is looking at how our senior centers are expanding that, taking the social isolation issue, but also incorporating it with technology. So one here in American Canyon, one of the things that the local senior center does is it has, we call it Bridging the Gap program. And they invite high school seniors to come over to the senior center, and they work with the seniors during the lunch hour, the bingo hour, on what issues they may be having with their phone. And it is, I've dropped in from time to time, and it is the cutest thing to be able to watch a grandmother start using emojis to text a grandchild, right? And that is a way of bridging that isolation, because we understand that younger generations communicate in a different way, and being able to bring that together. So those are just a few of the things that we've done. But I wanted to talk about one thing that you asked in terms of what was one of the real impacts on our community, in addition to the caregivers and not coming into the homes. Because the seniors were afraid of COVID and wanted to be really cautious. Another thing that we are still experiencing is an inability to meet the transportation needs of our seniors to be able to access services. And we have, I think I see the executive director on here, Deborah Smith. We have an amazing nonprofit in Napa County called Molly's Angels that teams up drivers to take people to doctor's appointments or whatever they need to be able to have. And it's a great service because it's very specific for this targeted population, and it's far more flexible than, say, public transportation, maybe, even though in the public transportation space we're trying to provide more on-demand type modeling as well to meet the growing needs of our seniors. But I think transportation has been a really, really big struggle for us. So we've actually commissioned a study to look at the needs, because this was a need before COVID, to be honest. It was just, we were forced to look in the mirror a whole lot more during COVID. None of this is a surprise, right? Isolation wasn't a new thing. Transportation needs weren't a new thing. Lack of IHS workers and low wages, not a new thing. But we've just been forced to look at it in a different lens. And so one of the things to make sure, we use some ARPA dollars, and we just said we got to look at this and see where are we at, what's a snapshot, and what do we need to be doing scorecard for ourselves, if you will.
Some really good points. And I think there's a lot of agreement on that. It appears like accessible transportation and prevention of isolation and connectivity and technology and thinking outside the box and all of those things together. I mean, as you said, these are not new things for us to be thinking about, but they certainly were brought to light in a different way during COVID. Supervisor Sackett?
If I apologize for interrupting, but since Napa and Solano are one area agency, I just want to share in Solano what we're doing with the iPads and stuff, which the participants can take home. That was a big concern we had. Is that what we're doing is we're taking our funds and going to the community college and hiring community college students to meet and be just like what the supervisor stated. But this way we're using the community college, we're having the generations meet, but now the kids can then put something on their resume of things that they have done. And that it was, I'm a former trustee, teacher, all that kind of stuff. And that was very important to me to make sure that we would do that and hope to generate, some talking kind of stuff. So same kind of thing, but just a different grade level. So I just wanted to share
critical partnerships.
Yes, exactly.
College you mentioned, the nonprofits that we all know are critical for working on these partnerships at the county level as well. So we'll go with Supervisor Sackett and then we'll go to Tracy.
I think it was Supervisor Murray who had her hand up.
Thank you. Not Supervisor Murray, but I am, but thank you for the promotion. I'm a staff member. I head up a department within the county. Susanna, your question prompts me to think about something else though, that, what did we learn from COVID? And for me, I think that this issue of equity, we're used to thinking in terms of race and poverty and gender. And what the COVID experience brought up for me is this issue of age in terms of equity, because what we saw is such a disproportionately high level of significant illness and death with our aged population. And I'm really very proud to be with a county that has such a strong partnership between social services, where I work, and health services. But I think that we were all caught off guard at first by this epidemic. And one of the things certainly that we learned from a health services perspective was that they couldn't do it alone. We went from having a very low vaccination rate to one of the highest in the nation. And that is in large part because health services partnered with community. And, I give credit to you, Susanna, with your agency, Empowered Aging and Choice in Aging. But what resonates for me is the continued need to consider this issue of equity and perception about age. And this is why I'm really excited about ageism campaigns. In some ways, through campaigns, I also want to normalize dementia. Not that I want dementia to continue, but I think that we all as a community have to be prepared to work with our residents, our family, our friends that have dementia. So for me, this has been a profoundly learning experience. And now we have the opportunity to move forward with programs. And I really applaud Susan at the California Department of Aging and the work that they're doing that we can implement with our community partners at a county and then city level.
Thank you. More good points. And the equity issue when it comes to aging. And I remember thinking during COVID, how do we reach the people that don't already have the connections, that aren't, for example, involved with the schools, that aren't involved, like going to the doctor on a regular basis, or, the people that are unreachable, that are not necessarily currently receiving resources and connected to ways to get information about vaccinations and about COVID. And so it's a very interesting topic. Supervisor Sackett, did you have anything you wanted to add? Okay, thank you. And I think we've touched a bit on the direct care workforce. And I think this is a huge issue. We know that we are not prepared for the numbers growing the way that they are. And so what initiatives or opportunities do you see to grow or support our professional direct care workforce? And what's the county's role to advocate at the state level for policy implementation that will support the staffing levels that we know we need to address the growing older population? And Supervisor Brown.
When I was looking over this question, the thought is that we need to reach into middle school and high school and do career days every year and let all of our students know what jobs are out there, and go to the state and say, we need funding at the community college. All of us have community colleges close enough that people can get there. There's lots of money right now going in that you can get an RN, because by 2030, something like over 400,000 nurses are going to be needed. And we need to make sure we have the workforce. Well, how do we get the workforce if our students don't know what jobs are out there? When I got elected 2 terms ago, I never heard of Area Agency on Aging, and I was over 60 because, you know, the word just didn't get out, and you get myopic in your life to survive with your kids and paying for that. So I think that's what we need to look at, is what is out there. And I know we have created some paths, and I know in-home support services is doing that on their own through their union. But I think we need to do that and bring in our K through 12 and higher ed, because if you want economic development in your county, you need to have a very good workforce. And how can you get that? Is if you have a very good public education. So those are my thoughts.
I think that's a really good point, and it's not one that you hear a lot of. So thank you for sharing that. Supervisor Gorin.
I really thank all of the supervisors. You've had some great ideas on the programs that you've initiated for transportation, digital divide. But I think and Sonoma County is really being proactive in reaching out to our seniors to help them access the services that they need, help them access the programs to keep their health, physical health, mental health. And so I think it's not only looking at the end of that spectrum with caregivers, what can we do to actually increase the health and increase the longevity of our seniors? And that's part of the master plan. But I would hope that all of us would advocate with the state legislature to be very proactive in boosting the wages of IHSS. We have so many folks in the county on the waiting list. We could encourage more to enter this profession if in fact they were paid a living wage. And I wish we at the county level had the funding to actually negotiate a much higher wage for them. But a lot of the negotiating power rests with the state. So I think number one, let's advocate on their behalf. But I really like Monica's suggestion on looking to the junior colleges on the kind of courses that we can provide to help our caregivers increase their professional development and social isolation, because I think they are isolated as well. And I thank all of the panel members for their great ideas and contributions, and I look forward to reconnecting with you maybe in a year or two. What have we done with our master plan on aging in each of our counties?
Some really good points. Thank you. Supervisor Miley.
Yeah, thank you. Well, in Alameda County, I'm pleased that we have been partnering with you, empowering the Empowered Aging, to implement the healthcare career pathways program. So I know you're familiar with that, Susan. So we're very pleased to be doing that. Another thing is the state has the Cal Grows initiative, which incentivizes training for paid and unpaid career caregivers. And though this is promising, we really feel the state needs to commit to continued funding of that program, the Cal Grows program, so that it can catch on and have impact over time. And then finally, statewide, I know counties have been working to ensure that the Child and Family Policy Institute of California, that initiative gets clearly implemented, because what that initiative would do is it's committed to supporting public human service agencies in meeting the needs of vulnerable adults. And that, I think, is another very important effort that needs to be continued and promoted.
Thank you. And if you're watching the clock like I am, you're seeing that we're getting a little low on time. And I think we've already touched on some of the access and technology that we were going to address. There's some questions about advocacy. There's a couple of questions in the chat, but I think we could also use the 5 minutes we have left to, you can address what it is that you feel like we haven't already discussed, or provide some closing remarks, anything you want to just kind of reinforce from what we've discussed so far. And I'll start with Supervisor Ramos because your hand is raised, but if anyone has some closing remarks that they'd like to provide, just to kind of wrap things up a bit, and we are happy to share questions with you once this panel is done to see if we can follow with your teams. Supervisor Ramos, please.
Thank you. I had a very unique opportunity in 2019 on behalf of all 58 counties to negotiate the IHSS agreement with Department of Finance and with NUHW and SEIU. And one of the things that, to Supervisor Miley's point, and also to what Supervisor Gorin said, is if we do not establish from an advocacy perspective at our level that the state has ownership in taking care of our seniors and ensuring care workers are adequately paid, we will always be in this place. The maintenance of effort to be able to, we had the efforts of taking money from this pot to this pot. And so you are literally faced with, I'm going to take away from children and early intervention so that we can fund in-home support services. We've got to have a sustainable maintenance of effort from the state of California going forward, without question. Now, not going to opine specifically on state bills that might uniform the structure of pay. But that in and of itself, when you look at how different counties are negotiating these contracts, it really comes down to where's the state picking up, right? If the state is able to pick up more, then that in and of itself will create a greater incentive. So from an advocacy perspective, I would say the greatest thing that we can do at the county level is to continue to put pressure on the state to ensure that the maintenance of effort continues to rise with our growing population and our growing needs. People live longer and there's more of them. So we've got to make sure that we're paying for taking care of our seniors.
Some fantastic points there. And I think the idea of advocacy is pretty much what this whole panel and this whole session is built around. When this panel is done, for that matter, we're going to be discussing advocacy, because not only is it important for the counties to do that and the cities to do that, but individually, we all have the right to do that and should be doing that. So we're going to learn some tips about that as soon as we're done with the panel here. Supervisor Sackett.
Yes, thank you so much. I always love the question about effective advocacy. And I think, I'm seeing a chat comment about not pitting populations against each other. I think it's incredibly important that we also not pit agencies against each other. And I will tell you, coming into this role in the last 6 months, there are a lot of aging efforts and acronyms and so forth. And I just think it's important to, when you are advocating, saying how you're working with others as opposed to why you should get the funding as opposed to somebody else. That's my perspective. Some might disagree. I think it's important, to Supervisor Ramos's point, that advocate at all levels, but advocate for the right thing at the right level, understanding what you're asking for and who can actually effectuate that change is super important. And the basics of effective advocacy, I think, are establishing relationships before you have an ask on the table, and being honest and trustworthy and doing your homework. Again, there's a lot of moving parts in agencies, and even within IHSS, there's two different department, the internal and the external, et cetera. So don't ever hesitate to provide a bit of education at the start of your conversation. And I think really, especially when it comes to the wages, being willing to compromise is really important. In many from Marin who are on this call, there's a big advocacy, to get IHHS workers to $25 an hour. We're at $16.85. We're hoping to get to 18, and I'm pushing for $18.50 to go straight to 26 I don't disagree, but it's in one fell swoop, it's not easy. So being willing to, acknowledge even incremental wins and support those, even if it's not everything you want. So I really appreciate this discussion and opportunity.
I appreciate the willingness to listen on the advocacy front. I think that's really important. And I love hearing that from all of you. We're going to close out soon, but one final comment, brief comment from Supervisor Brown, please.
Well, I think we should look to the feds because they only give us 50%. It would be nice if they up that. That would be very helpful. When I was preparing, I looked at some bills that had gone through and became law, SB 591 and SB 170. And I just picked those two because they look good. And the reason for it is when we advocate, we need to also let the people that are going to be voting to say, hey, good job. This is what you were able to do. That's why we need to move forward. You need to show people that working gave a good product at the end, if that makes sense. So I always say to my folks is that you need to hold your elected officials' feet to the fire. Did they do what they say they were going to do? Do they have something to show you? And if so, then you can keep going. And that would be my thought in terms of advocacy.
Great. Thank you very much. I think this has been a fantastic panel. I've certainly learned a lot from all of you about the work that you're doing to address these needs. And I thank you so much for taking part in supporting these efforts. Feel free to stay on and learn from the rest of this session. But in the meantime, again, thank you so much for all you're doing to address and support the aging population and the disabled population. Take care, everyone.
Thank you so much, Susanna, and all of our county leaders. We truly appreciate your leadership, advocacy, and this very candid conversation. This was wonderful. So this morning we have heard the state's perspective, we have heard the county perspective, and now we want to hear from all of you. So in a few moments, we are going to move into small groups. You will see breakout sessions pop up on your screen, and you'll have a chance to choose from one of 4 topics. And let me put up my slide so that we can all see and learn together about what we're about to do next. So there will be four different groups for you to choose from. So group 1 will have discussions around the direct care workforce. This could be around IHSS workers, which we heard a lot about during the county panel, or those who are employed as a caregiver for their job. Group 2 will have discussions around unpaid family caregivers. So those who care for their own family members or loved ones, but you are doing this on your own time. Group 3 is around the virtual care expansion and the digital divide, which will explore solutions around technology, for instance, that can support all different kinds of caregivers. And group 4 will talk about the financial burden of affording care. So what advocacy or policies are needed to make caregiving more affordable or to help someone pay for their care. If you do not see the pop-up for breakout sessions in a moment, you can click the dots at the bottom of your screen and click breakout sessions. You also can just stay where you are, and I will help manually assign you to the session of your choice. So when we are in the small groups, you will be discussing 2 questions around that topic. So direct care workforce, unpaid family caregivers, digital divide, or affording care. And there will be 2 questions that the facilitators will be asking you. Number 1 is, what did you hear that resonated today? And that can be, from the entire morning, kind of specific to the topic that you're there for, but we definitely want to get your feedback and hear, what did you think about the discussion this morning? And the second question is, what actions will you commit to elevate this issue? So direct care workforce, unpaid family caregivers, and what solutions do you have to make this happen? And so this can come, again, from things that you heard this morning that you really liked, something that may be missing. I know that we are all doing this work in so many other places, and so you may have something new to share that we haven't talked about. There are a few ways that you'll be able to participate in the discussion. So you will be able to unmute yourself and share your comments. You can put your comments in the Zoom chat. And then we are also using this tool called Jamboard, which you may or may not be familiar with. And what Jamboard is, it's a very easy and interactive way for you to share your comments. And we will have staff who will screen share that for you. They will put the link for Jamboard. You will be able to go directly into it. And they have a little sticky note feature where you just click on that and then you can type your comments in, hit save, and it'll pop up on the screen with everything that everyone else is sharing at that moment. And our staff can help to rearrange it, help, make things bigger if we need to. But, we want you to just use the time. We only have about 20 minutes for these discussions. So we don't want you to get caught up and stressed about trying to use Jamboard or these other features. If you just want to unmute yourself or use Zoom chat, please feel free to do what's comfortable for you. Okay, great. Welcome back, everyone. I'm sure that we could have spent much more time in those small group discussions. There seems to be a lot of activity. But we wanted to continue with our program and have a chance for us to hear how all of those discussions went. So I am going to move around to our different facilitators. I think we may have just lost Uche.
Catherine, Uche was struggling to be able to, there he is, good.
I'm here.
Oh, okay, switching devices maybe. Okay, no problem. So just to briefly introduce our facilitators, Uche is with Center for Elders Independence. He led the conversation around the direct care workforce. Jenna Shankman is with the Family Caregivers Alliance and co-led the conversation with Unpaid Family Caregivers. Celine Regalia from the Providence Community Health Napa Valley led the Virtual Care Expansion Digital Divide conversation. And Eli Gallardin with Marin Center for Independent Living led the conversation around addressing the financial burden of affording care. So I think I'll move through in that order just to keep things simple for us. So we'll go to the first question. So Uche, what did your group talk about in terms of what really resonated with them during the conversations this morning?
We actually had a very, let me get the, Suzanne, help me get that, or where's our,
do you want me to share the Jamboard link in the chat?
Right, please, yeah,
Okay.
can see it here.
And the Jamboard link is still active. And so if you want to go in, you can actually scroll through and see all of the comments from all of the sessions. I'm not going to put it up on the screen because it'll become very crowded very quickly, but we're going to clean that up and share it out for everyone after the meeting as well. So you all can have those notes. So Uche, are you able to pull it up?
Yeah. So we have, let me see here. Let's see this. Okay, here you go. Give me a second. I'm trying to enlarge this so I can see it. Okay.
That's okay. Do you want us to move on to Jenna while you get?
No, let's move on. I got it. So
okay, go ahead.
that the counties need to explore solutions using county resources, but also advocate for state and federal solutions and funding. Commitment by the elected officials. It was really impactful to hear the personal experiences of panelists. No matter our positions or the resources we have access to, we all go through these challenges. The issues learned from COVID, I appreciated the creative thinking and the different ways counties worked to meet the needs, new or exacerbated. Working with various agencies to provide support and resources for the growing aging population. Let's see.
It sounds like there was a lot of interest in the discussion around the counties and their roles with supporting direct care workers, but also certainly all of the other issues impacting caregivers, but also a lot of opportunity there. And I heard the comments loud and clear around funding also and the important need for that. Great.
Absolutely.
Great, thank you. Jenna, let's move to you around the conversation, thinking about the unpaid family caregivers.
Yes, so one of the things that really resonated with folks was hearing the stories of unpaid family caregivers, both in the video, but also a lot of the other speakers who shared those stories. They talked about the need for navigation of resources for the missing middle, the stress and strain that unpaid family caregivers experience, trying to balance it all, the importance of having a break then and livable wages. Yeah, so those were some of the things that people really highlighted, and then they immediately started getting into solutions just naturally, which was awesome. So some of the things that we talked about in terms of solutions were using paid family leave and advocacy work to make paid family leave more accessible, and also different programs that would provide more funding and sources directly to family caregivers. Maybe it's advocating for a caregiver tax credit or supporting legislation related to a social long-term care insurance, like Susan alluded to, that we've started to see modeled in Hawaii and Washington, and that we hope California will have soon. We talked about joining the California Coalition on Family Caregivers to advocate, and then there's a number of other volunteer opportunities with the Alzheimer's Association, and it sounded like with the AAAs as well. Let's see, sending an email to our elected officials such as Board of Supervisors to get the No Wrong Door and also Adult Day Health Services back in Marin County, where unfortunately all those programs have closed. So like thinking about the gaps and really advocating specifically for those gaps. So yeah, those are some of the things that came up in the short time. So
Wow. That's wonderful. And I think that, you know, having different kinds of supports for unpaid family caregivers, whether that be respite, whether that be paid family medical leave, whether that just be more resources. You know, everyone's situation is different, and there certainly seemed to be a lot of discussion around opportunities this morning to support unpaid family caregivers. So thank you so much, and to those who participated in that discussion. Celine, let's hear about what resonated with the group today. You know, I know that a lot came up actually around digital divide and virtual care throughout the discussions this morning. So what did your group think about those topics?
Yeah, so I mean, I had consolidated my thoughts at first, to access and affordability, the resonation of navigation and care coordination, that we need these devices to help with some of those solutions for people that have access issues. And then our group really, what resonated was, training, that there's a big need for training. It's not like a one and done. And so what opportunities are there for training, for partnerships, for intergenerational approaches? And Jerry brought up a great point of just that we can bring different communities together, not just older adults, but, by rising our whole community up with technology literacy, then our whole community is a healthier community. And so we talked about, the two big things for advocacy were sustainability. Like there's this initial investment we heard from Susan DeMorris about the 17 million, but the long-term sustainability, because technology changes and it advances. So we need to make this a ongoing investment in our communities. And then another person brought up the investment in the changing needs of telehealth, and how do we keep that first and forefront for people, the importance of telehealth as a way for people's wellness and for caregivers' wellness. And then finally, looking at partnerships with maybe people that we don't think of. It's usually the community-based organizations, but health plans have an investment in this outcome with linking people and the private sector and community services like our libraries and our senior centers, and just looking at different partners to bring this work forward.
That's wonderful to hear. I know there was a lot of discussion this morning around different kinds of partnerships, and it certainly seems that around the digital divide and virtual care expansion, that those partnerships are truly essential. Some organizations don't have the infrastructure to take that on their own. And so having those partnerships will really make it happen. And then in particular with, over the course of the pandemic, we all had to shift very quickly to virtual settings. but in many cases that tends to be something that is preferred. And so how do we continue to provide those options for people to support caregiving and to support the work that they do through telehealth and other means, even as we're returning to a lot of things in person. So that's wonderful. Thank you, Celine. And Eli, you led the conversation around affording care. And so can you share with us what resonated with the group today? And we can even flow into the second part of the session too, around any solutions or advocacy opportunities that came up.
Yeah, thank you, Catherine. And, certainly a lot of the themes that were just brought up around long-term care and, how we afford long-term services and supports, and potentially going into the solution of middle income benefit to cover long-term care, kind of recognizing how the cost of care impacts, it's an intergenerational impact, right? It's impacting our young people, our folks in the middle who are caring for older adults, as well as children, obviously people with disabilities across the ages. Other reflections really around, the fact that we need to do more messaging and how we communicate on the role of caregiving as a value in our society, valuing our caregivers, valuing our individuals, older adults and individuals with disabilities who receive care, and kind of just creating more awareness for the care ecosystem. There was also a lot of discussion and reflection on kind of, how are we supporting not just in-home support services and folks living in the home, but in those transitional care facilities, whether it's adult day healthcare and memory care, skilled nursing, and recognizing that we have such a limit in the number of skilled nursing facility beds for our low-income individuals and family members. In terms of kind of creating this roadmap and like recognizing that navigating care is also just really challenging. And so, maybe if we go into this campaign approach of education, also kind of giving and creating guiding resources for families who are struggling in navigating care. And then one other big component that came up kind of around affording care is actually affording housing, because the link between our caregivers and families who are struggling.
Uh-oh, Eli froze. Uh-oh, Eli, if you can still hear us, your video froze at a very, very important comment. You may want to try turning off your video if you're still on. So I think to kind of reflect upon the conversation as well, it seems like the conversation that Eli led, there were a lot of other topics that kind of naturally came up that were separate from the specific topic that you were discussing. And so for Uche and Jenna and Celine, I guess as we're wrapping up our report out, was there anything else that came up during your sessions that you'd like to share with the group that didn't specifically fit into the little boxes of what we were asking for you to talk about?
Yeah, from that group, we talked about workforce training. Obviously, we don't do enough training for folks who provide services in this environment. We want to, the group really focused on the adult education part, which I think we're not putting enough resources in training our adult education folks or people who are coming back into the workforce. So that's, and then the quality of care. Someone really talked about that. We don't want to forego the quality of care, and we also want to make sure that there's check and balances. There are someone there that comes in to check that, to make sure the quality of work they're doing is good, not just come in and sign off, to make sure. So That's really important. Give our aging population deserve something good, and we all have a responsibility to make sure that they get it.
Absolutely, absolutely. Thank you, Uche. I'm glad that came up, because that's certainly a very important topic. Eli, I'm so glad that you found your way back to us.
Yeah, so apologies. It's Friday and my computer's ready to shut down. Just briefly, the last comment was just really around affordable housing and the connection between caregiving and housing, and how do we leverage creative housing solutions like ADUs and shared housing or live workspaces, so we can kind of address those multiple layers of care and affordability, and kind of support our caregivers as well as our families in navigating, the housing economy, which, like the care economy, is incredibly complicated in our state right now.
Absolutely. Well, thank you so much, Eli. Thank you, Jenna, Celine, and Uche, for leading these discussions. We will be synthesizing the notes that are on the Jamboard. Of course, this session and the breakout sessions are being recorded as well, so you'll be able to go back and to dive in a little bit deeper if you missed something, or if you wanted to listen to another topic. Everyone will have the opportunity to do that. So thank you again for all of you for your participation and for leading these discussions. So now we are moving on to our last speaker and presentation of the morning. It's my honor to introduce Katie Duberg, who is the Political Organizing Director with the California Work and Family Coalition. Katie is going to energize us with her presentation on a call for action, achieving effective advocacy. So Katie, we will hand it off to you.
Thank you so much, Catherine, for that really kind introduction. And it is just really an honor to be here with all of you today talking about such important issues. I've been really moved by everything that's been shared so far, and I'm excited to talk a little bit about achieving effective advocacy. So I wanted to just share a little bit about the California Work and Family Coalition. The California Work and Family Coalition is a statewide alliance of organizations united in the belief that all people should have the time and resources to care for themselves and each other. Through organizing, advocacy, and education, we are fighting for a world where all workers and family members have access to paid leave to bond with new children and care for our families. So this slide has information about our staff team. And I also just wanted to uplift our incredible coalition members, some of whom are on this call and who we work really closely with to educate folks about paid leave and also expand who is eligible. So let's dive into just a brief introduction to the California state government and Advocacy 101. So as we, I think, heard already today, we have elected officials who make laws that govern the city or town where we live or work, the county where we live or work, the state of California, and the United States. And the issues that we've been discussing today really do impact and are decided by lawmakers at, I think, all of these levels of government. And since we did hear from County Board of Supervisors today, I wanted to provide links so that you can look up, if you live in one of these counties, who your Board of Supervisors representative is. And if you live in a different county, you can usually find your district by Googling the name of your county Board of Supervisors to find the official county government website. And typically there's a link on that homepage that you can click on to find your district. So for the rest of the presentation, I am going to be focusing on California state government and advocacy, because that's where I work most closely at the Work and Family Coalition. But I will say that a lot of the skills that we're going to be talking about, I think, are transferable to other advocacy settings as well. So at the California state government level, we have 80 assembly members, we have 40 state senators, and we have 1 governor who make decisions that impact all of our lives of those who live in California. And this might seem really basic, but I do think it's very important for us to remember that each assembly member and senator does represent us. So all of us have both a state assembly member and a state senator. There are more state assembly members, so those districts are a little bit smaller, and fewer state senators, so those districts are a little bit bigger. And I've provided a link on this slide so that you can look up who your state assembly member and state senator are. All right, so I wanted to give a little bit of background about how the California state legislative process works, because I think it involves a number of steps, and advocacy can be really important at each one of these steps. So when you're looking at how a state bill becomes state law, this is the process that it goes through. So it starts out as someone's idea, right? All bills start out as ideas, and there were a lot of great ideas shared during today's call already. Then a state assembly member or a state senator will introduce that bill. And the next step after bill introduction is that it is heard by a policy committee, typically at least one, sometimes more than one. And then often the bill will go to the appropriations committee to look at the financial impact. And the bill has to pass both of those committees, meaning that a majority of committee members need to vote, yes, I support this bill, in order for it to move on to the next step. After that happens, then the entire state assembly or state senate gets a chance to vote on the bill, and a majority of members have to say, yes, I support this, in order for it to pass out of the House of Origin, which means the house where the bill was introduced. And so then the process is repeated in the other house. So if a bill starts out in the assembly, it goes through this process in the assembly and then the Senate, and vice versa if the bill was introduced in the Senate. So we have policy committee, appropriations in the other house, and then floor. All of that, the bill can either go straight to the governor, or if it was amended or changed significantly in the second house, it actually has to go back to the first house for another floor vote before it goes to the governor. And then at the end of this whole process, the governor can either sign the law or the bill and it will become law, or the governor can veto the bill and it will not become law. And essentially at each one of these steps, a bill can proceed, as I just described, or it can be held if there's not enough support, or it can be changed. And so advocacy can be really important at multiple points during the California state legislative process. So I think this is really important to remember. You do not need to become a policy expert in order to be an effective advocate for change, because you're already the expert on your own experience and why a bill or issue matters to you. And you can certainly develop policy expertise or advocacy expertise by advocating, but by knowing your own experience and why something matters to you, you already know the most important thing to be an advocate. So in thinking about why should a legislator hear from you, right? Legislators have to balance a lot of different interests and perspectives as they make decisions about what legislation to support, and they just may not have heard or thought about your unique perspective. And when you contact your legislators about a bill or an issue, it reminds the legislator or the staff person, because typically you'll be talking to a staff person, that the bill or issue is important to their constituents and has real impacts for people living in California. So I wanted to provide some examples of how you can be an advocate in 5 minutes or less, because we know that caregivers are very busy and have a lot of obligations, but you can take action in less than a minute or less than 5 minutes that can be really impactful. So if you have less than 1 minute, I would suggest using an action alert. These are typically set up by an organization that's supporting a bill or an issue that you care about, and they make it possible for you to email or post social media directed at your lawmakers just with a couple of clicks. If you have 2 to 5 minutes, you can spend a little more time and call your legislator, again, either through an action alert, or you can look up your legislator's office phone number and call their office directly. You can also write a personalized email to your legislator, and most legislators have a contact form on their website that allows you to do that. So if you have more than 5 minutes, you have tons of options. You can ask your friends, family, or community to take the same action that you took. You could join a virtual or in-person meeting with your legislator. You could join an event like a virtual or in-person advocacy day. You can organize your own event. You can join an organization. You could start your own organization. So I wanted to talk a little bit about what to say when interacting with the legislator or your staff, or sort of how to develop your elevator pitch about why a bill or an issue is important to you. And to do this, we're going to be using SB 616, which is a current bill that's been introduced in the California State Legislature to expand paid sick days. And I do just want to note this disclaimer that the bill is being used in this presentation for illustrative and example purposes only, and does not imply the endorsement of event host organizations. So it's helpful to have a little bit of background about current law before and the impacts of a bill and how it would change current law. So I wanted to review that first. So under current state law, California employers can cap paid sick days at 3 days per year. And I think we can all agree that 3 paid sick days is not enough. As people may recall, we did have temporary COVID-19 supplemental paid sick leave in place in 2021 and 2022 that provided California workers with up to 80 hours of paid sick leave to take for their own COVID-related reasons or to care for a family member, but that leave, unfortunately, is no longer in effect. And there are a number of California cities with local laws that already require employers to provide more than 3 paid sick days for workers who are working in these cities. So I've listed them all here. And then each city name is hyperlinked to a place where you can find more information. And you can see that there's a real range. So San Diego requires 40 hours and West Hollywood requires up to 96 hours. So what are paid sick and safe days? Paid sick and safe days can be used for your own illness or preventative care, or to care for a family member. And that includes the diagnosis, care, and treatment of an existing health condition or preventative care like annual checkups. They can also be used to seek care or services related to domestic violence, sexual assault, or stalking, which is why we call them paid sick and safe days. Next slide, please. And so I wanted to highlight too, how do paid sick days impact family caregivers? So when workers run out of paid sick days and staying home can mean losing their job or necessary income, it essentially forces many workers to continue working while they're sick, or if they just have to stay home because they're too sick to be able to work, they may lose their job or their pay. And so I think fundamentally, no one should be forced to make this choice. But we've also heard a lot about the need to have high quality jobs and protections for professional caregivers. And so we definitely want professional paid caregivers to have the ability to stay home when they're sick, not put the folks that they're caring for at risk. And similarly, we're all put at risk if the workers that we're interacting with at the grocery store or anywhere we're going to seek services don't have the ability to stay home when they're sick. And then for unpaid family caregivers, we know, according to 2020 data from the California Health Interview Survey, that 64.4% of caregivers in California are employed, which means that unpaid family caregivers may need paid sick days too for their own health or in order to care for the person that they're caring for. And I also just wanted to note that as I know this won't be news to you all, but those categories aren't necessarily separate, right? Somebody may be both an unpaid family caregiver and also a professional caregiver. So enter this bill introduced by Senator Gonzalez, SB 616, which would require California employers to provide up to a minimum of 7 paid sick and safe days per year. SB 616 is co-sponsored by a number of organizations, including the California Work and Family Coalition, and is currently supported by more than 140 organizations. It's passed the Senate Labor Committee and has been referred to Senate Appropriations. So if you think back to the graphic that we discussed a couple minutes ago, it's at the very beginning of the legislative process. All right, so let's practice how to develop your elevator pitch to share why SB 616 is important to you. So when you're thinking about what you'd like to share with a legislator, or most often in my experience, you'll be interacting with staff, we encourage you to share what you're comfortable with and what feels empowering for you to share. It's totally fine to get emotional when you share your story. And I think a lot of times the most emotional parts of our experience are the most powerful. And it's exactly why the things that we advocate for are so important. But it's also okay to leave certain details out when you share your story. One, because you want to be succinct, but also if you're just not comfortable sharing a particular part of your experience, that's totally okay. And it's always your decision what you want to share with your lawmakers. So this is how I recommend that people think about how to develop their elevator pitch. So first of all, thinking about describing why you care about the problem that the bill would solve. So this could be based on your personal experience. Maybe you personally right now are being impacted by this problem, and if it were to pass, your experience would change. Maybe you see this problem often in the community that you live or work in. You could see the problem as important to solve because of your values or beliefs. So kind of describing briefly the problem, and then coming in with, and then Bill X, Y, and Z would address the problem that I referenced because I personally would have had a different experience. People in the community I live and or work in would benefit, or I would see my values or beliefs reflected in our laws. Excellent. So what I wanted to invite everyone to do is just take a moment to kind of think about this, and to please enter into the chat if you were contacting your legislator to share why SB 616 is important to you, what would you say? All right, so I'm seeing in the chat, COVID-19 has made it clear that we need more paid sick days to keep our community safe. And this is particularly true for family caregivers who are trying to balance work with caring for someone whose health may be vulnerable. Yes, exactly. So speaking about, I'm seeing this in the community that I'm working with. Some great advice to not get mad and watch the language. So very true, right? It's very important to remember you're always interfacing with another human being and to treat people with respect. Let's increase the support of paid sick leave. SB 616 is important to me because it will provide me with more of a balance between work and family. SB 616 is a fair and just way to ease the challenges of being a caregiver, allowing caregivers to work with dignity. I was able to care for my parents because I had the privilege of working in a way that allowed me to be with them, a gift I will always be grateful for. Yeah, really powerful. Caregivers are real people who are balancing a lot. Providing extra paid sick days isn't a huge ask. And someone saying they're using the template. I personally have challenges when I don't have enough sick time because my kiddo is a heart warrior and sometimes has many appointments. SB 616 would allow folks like me, a single parent, to take care of my kid without risking my employment. Yeah, exactly right. I think everything that people have shared would be really impactful to share with legislators. And so just really want to underscore that you all already know how to do this, right? Because you know how to communicate why these issues are important to you from your own experience. And I'm seeing one more comment come in. Having an inadequate amount of paid sick leave requires people living paycheck to paycheck to choose between going without pay and going to work sick, which is harmful to everyone. Yes, exactly. So I want to be mindful of time. So I think if you have additional comments that you want to share in the chat, please go ahead. Or if you already started, don't want to cut anyone off, but did also want to allow for any questions, which I think is the next slide. So yes, any questions? Yep, and a great additional comment, thanking the legislator first for their service, which is a great way to start. And I encourage you to add your support for SB 616 that will allow additional sick time for family caregivers who, as I know from personal experience, are critically important to families and communities. Yeah, great. So does anyone have any questions? So I'm seeing a question, is there a place to go and see the list of bills under consideration during the session? That's a great question. So I can say for my organization, we have a list of our priorities for this legislative session up on our website. And for a lot of groups, I think that's the case also. I don't know of one single location where you can see easily like all of the different bills on every topic. So my recommendation would be to kind of check out the organizations who are working on issues related to family caregiving or other issues that you care about to see what bills they're tracking this year. Yes, and once you know the bill number, thank you, Jenna, for putting that in the chat. Everyone can look up the bill text, committee analysis, votes, all those things on that website. It's a great resource. Which is more effective, email or phone call? You know, okay, so there's kind of a rule of thumb that phone calls are typically considered more effective than email. And I think it's because of the extra time that it takes to make a phone call. And I think offices know that, but so I think if it's possible to call, I would recommend that. But I think the best advocacy action is the one that's doable for you. So if what's doable in your life is an email, taking any action is always better than taking no action. And yes, I just saw Jenna posted the full list. So thank you so much. That's super helpful. Yes. And so hearing from someone that they like emails, which is great. On the website, yes. So on the LegInfo website, you can search by keyword and you can for free set up notifications to receive notifications when different things are happening with the bill. So that can be a really helpful resource. All right, I think I'm at time. So I just wanted to go to one more slide if possible. Yes, so I just wanted to highlight that we do have a resource hub on our website that does have a specific page set up for learning about paid family leave and other workplace rights for family caregivers. So just wanted to provide that as a resource. And that's it. So thank you all so much. It was really an honor to share this information with you all. And thank you for all the great work that you're doing.
Great.
Thank you, Katie, for energizing us to move our work forward in the community and support our caregivers and the master plan for aging. Let me quickly recognize Margarita, Shana, Hambato, and Terry for sharing their stories. And thank you, Susan Demaris, and our amazing county leaders. And thank you all for spending the morning with us. We know you could have been somewhere else. And continued progress will require our continued commitment and our collective ability to partner with our elected officials to deliver on the commitments laid out in the master plan for aging. Please take what you learned today and talk to your elected officials. Join a stakeholder committee or volunteer with an organization supporting caregivers. So please organize, lead, and don't stop. Thank you very much.
Thank you, Uche. And we are so incredibly energized by all the investments that have been made and the partnerships that have been formed, but we have a lot more work to do. And as a couple of our speakers said this morning, the Master Plan for Aging is not just a government document that is sitting on a shelf. It's an initiative that is truly going to take all of us to make into a reality. And so we encourage you to follow us on social media, visit our website for more information. We will be sending out a survey, and we would love to get your feedback on this event and other topics that you may be interested in the future. And lastly, I would like to ask you all to save the date for the Senior Health Policy Forum, which is an in-person conference that we will be hosting at Mission College in Santa Clara in December of this year. And so if you received an invitation for this event or joined us today, you will get a save the date for that and an invitation for that event. And thank you all so much for joining us today. Hope everyone has a great Friday and a great weekend. Take care.